Good morning, everyone. Welcome to the Hindu's Health Webinar Series. Today's session is on heat and health, what you need to know, an important and timely topic. As temperatures continue to rise across many regions in India, heat-related illnesses are becoming a public health concern. For instance, in Chennai, the city that I'm from, the temperatures touched or even increased to as much as 41 degrees Celsius in the last 3 days. Today, there's a small respite with what looks like a thunderstorm. But what can heat do to human body? Prolonged heat exposure can affect people of all age groups and may lead to dehydration, heat exhaustion, heat stroke, and worsening of existing medical conditions. Particularly vulnerable are children, pregnant women, senior citizens, and outdoor workers. Through today's discussion, we aim to help people understand better the health risks associated with extreme heat, recognize early warning signs, and learn practical ways to stay safe during periods of high temperature. We have two experts with us today, Dr. Jaichitra Suresh, Senior Consultant Physician and Diabetologist, Saukya Clinic and Home Healthcare, and Dr. Karthik Gunasekharan, Professor, Department of General Medicine, Christian Medical College, Vellore. I'm Geeta Srimati, Senior Reporter, The Hindu, and I will be moderating today's session. A warm welcome to all our viewers as well. Kindly drop your questions in the chat box and we will take them up towards the end of the session. We shall now begin the webinar. I now invite our first speaker, Dr. Jaichitra Suresh. Dr. Jaichitra is a senior consultant physician and diabetologist with extensive experience in internal medicine, diabetes care, preventive health care, and family medicine. Her work focuses on managing lifestyle-related disorders, chronic illnesses, and improving public awareness on preventive health practices. She will be giving us an overview of heat-related illnesses, warning signs that require medical attention, and practical ways individuals can stay safe during periods of high temperatures. Over to you, Doctor.
Good morning, everyone, and I thank the Hindu for giving me this opportunity. I'm going to talk on overview of heat-related illnesses today. So, can I get my presentation? So, heat is an important environmental and occupational hazard. With global warming, actually, there is increase in daily temperatures during summer. Along with that, uh, actually, frequent global warming causing global warming is an important reason for temperature rise during summer and frequent heat waves happening also. It is a public health challenge because heat can affect the human body. Next slide. Next slide. Heat is stress to the body. So stable body temperature is essential for the functioning of the body. So, if the temperature has to be maintained around 37 degrees, which is the core normal temperature of the body has to have a thermoregulation mechanism to adjust its temperature irrespective of the environmental temperature. So during summer, when there is increase in the body temperature because of prolonged exposure to the heat, or if a person has a strenuous exercise, there is a lot of heat generated by the body, and to reduce this temperature and bring the temperature to the normal 37 degrees centigrade, there are a lot of physiological changes which happens in the body. What happens is there is vasodilatation and sweating, which causes the body temperatures to come down and the body milieu is maintained. And if there is fall in temperature, there is vasoconstriction and the sweating mechanism is stopped, and also there is contraction of muscles to actually generate heat, which brings the body's temperature to 37 degrees centigrade. It is the core temperature which is usually measured by a rectal thermometer and other ways of measuring that body temperature using oral or skin temperature with thermometer may not give us the true value of the temperature of the body. And all human beings are warm blooded, and this 37 degrees centigrade is essential for us to have a normal functioning. Next. See, there is a center in the brain, which is the thermoregulatory center in the hypothalamus, which actually senses the changes in the temperature around us. From the periphery and the visceral organs, the temperature signals are sent to this center, and from there, this center actually gets the input and modifies the action of the skeletal muscles, the sweat glands, and the skin arterioles to control the temperature so that the body function is maintained. Next. So, what are all the ways by which the heat loss mechanism happens is by radiation, which is the transfer of heat from the body through electromagnetic waves, and through evaporation. Whenever the body's heat increases, temperature increases, what happens is sweating happens, and the evaporation of sweating actually causes the temperature to come down. And there is convection, where there is transfer of the heat from the moving liquid or the solid to the environment, and the conduction is the direct contact with the cooling material transfers the heat from the body to outside environment. Next. So there are who are affected. Most of us who are not acclimatized to this heat can affected. So everybody should take the precautions. But more importantly, there are personal risk factors, which is based on the individual's risk. The people who are working outside in the hot weather and the type of weather that we have in our environment also. The personal thing is actually if a person is dehydrated, not drinking enough water, or the person is having heart disease, diabetes, high blood pressure, and he has a cold or flu, and a pregnant woman, and the people who are on multiple medications can be at risk of this heat related illness. And the people who are working outside, the outdoor workers, when they are exposed to this long duration of heat exposure, if they are actually have not taken sufficient water, or if they have not taken sufficient rest during the work, and also and they are not acclimatized to working in the hot environment, those are all the risk for getting heat related illnesses. And if the weather is very high and it's very humid, that also contributes, because if the humidity is more than 70 degrees, 70%, the evaporation of sweat to lose the body heat may not be functioning properly. And this can lead to heat retention and heat related illnesses. Next. Apart from these risk factors, there are other risk factors like elderly people with multiple comorbidities and children, because their thermoregulatory mechanism may not be able to match the requirement for controlling the body temperature. And also, they may not be in a position, if they are disabled, or if they are not in a position to take care of themselves, to get the adequate water intake, or to stay in a cool place, or if they are actually on medications which can like diuretics and heart disease medications, then the risk of heat related illnesses goes up. Next. So, what are all the common types of heat-related illnesses? It can be from as minor as a heat rash to as severe as a heat stroke. So, heat rash, heat cramps, and heat syncope are usually very mild form of heat-related illnesses, but it has to be taken care of properly, and the warning signs needs to be actually for taken into account, and sufficient preventive measures has to be taken so that they don't go in for the more severe form of heat exhaustion and heat stroke. So each type of heat illness has its own set of symptoms, which we need to recognize and make sure that the patient is taken care of well. Next. Heat rash is the reddish rash which appears in the body where there is increased sweating, and the skin irritation is caused by the excessive sweating, and there is clogging of sweat glands which can cause the inflammatory reactions. And the best way to take care of this is to cool down the body with frequent showers and keep the skin dry, and apply some calamine lotion or moisturizers to soothe the skin, and keep, making sure that there is no excessive sweating. Actually, the heat rashes can be diminished. Next. So the next form of heat illness is heat cramps. It is actually involuntary painful contractions of the muscles that can happen. This usually occurs when the person is standing in the hot climate for a long time, and he's dehydrated, and because of excessive sweating there is dehydration along with that electrolyte imbalance also, which causes the person to have this cramp. So these people have to be well hydrated, and electrolyte replacement needs to be done. Next. Another heat illness, which is very important, is to recognize it heat syncope. So, if a person who is not acclimated to the hot weather, and he works in or exposed to the heat for a longer time, and when he's dehydrated, the vasodilatation that happens to dissipate the heat reduces the blood pressure, because the venous return to the brain diminishes and can cause lightheadedness and fainting, which is usually a transient loss of consciousness which occurs. Most of these people will recover quickly if they are moved to a cool place and given fluids. And the thing is that body temperature may be normal in people who have heat syncope. Next. Next, moderately severe form of heat illness is heat exhaustion. If people are exposed to heat and their body is not able to lose the heat formed because of the hot weather, or because of the dehydration and other things, where the people with heat exhaustion can have, they feel tired when they are at work, there'll be slowness in their working, and they can have nausea, vomiting, headache, muscle cramps, dizziness, and they'll be heavily sweating, and they may have increased fast heart rate and heavy breathing also. Usually their body temperature will be on the higher side, and it will be less than 104 degree Fahrenheit in heat exhaustion. Next. When proper precautions are not taken, if the person is not treated during heat exhaustion, the heat related illness can progress to heat stroke, which is more severe, because if not taken care of, the risk of a life threatening illness is there and can lead to multi organ dysfunction. The difference between heat stroke and heat exhaustion is, here the brain function is also affected, and the sweat mechanism fails, and the patient, because of not able to reduce the heat through sweating and evaporation of the heat from the body, can go in for multi-organ dysfunction, and they need immediate treatment, and the body temperature goes above 104 degree Fahrenheit in people who have heat stroke. Next. So, what are the difference between heat exhaustion and heat stroke? In heat exhaustion, usually the temperature will be less than 104 degree Fahrenheit. They can have symptoms of fatigue, giddiness, and heavy sweating, but usually the skin will be moist because the sweating mechanism is still working. and that there won't be any neurological features of heat illness like seizure or confusion or coma. In heat stroke, the temperature will be more than 104 degree Fahrenheit, and there will be, as I told, the neurological problems along with the symptoms of heat exhaustion. Differentiating is very important because in heat exhaustion, the patient can be given sips of water, but with heat stroke, with the rising temperature and the neurological problem, nothing orally can be given, and patient should be cooled immediately and shifted to the hospital for further management to save the life. Next. So we should be aware of the warning signs of heat-related illness. So whenever we are exposed to high temperatures and people with actually multiple comorbidities and the risk of the heat related illness is high, then increase in body temperature, dizziness or nausea, vomiting, headache, and palpitation, we should take it seriously and make sure we are not dealing with heat related illness, and we need to differentiate from other causes and treat immediately so that it don't progress to heat exhaustion or heat stroke. Next. So this is a small representation of all the heat-related illnesses and what can be done. As I told earlier, in heat rash, we have to cool the skin and keep it clean and dry, and use calamine lotion for comfort. In heat cramps, actually muscle cramps, apart from keeping the person in a cooler area, we have to replace the water as well as the salt. In dizziness and fainting, the patient needs to be moved to a cooler place and elevate the legs so that the blood supply to the brain returns, and uh, fluid has to be replaced. And in heat exhaustion and heat stroke, the same thing of moving them to a shade. Cooler place and replacing the water, and immediate medical attention needs to be given so that the patient is saved. Next. So the heat illness is preventable, and usually most of the occupational health places have developed protocol to keep their workers safe, and also people at home, the elders, have to be taken care of with all precautions of keeping them cool and giving them enough fluid and monitoring them so that they are saved from the excess heat during summer. Next. So this is the occupational guidelines which says how to prevent heat illness at work. Usually, the first week is more important. If a person has joined new to the work or returning to work after a long break, actually they have to be given frequent breaks and follow the 20% rule, that they should be exposed to heat only 20% of the shift duration, and slowly increase the time of exposure every day by 20%, so that by the end of the week they are into full working mode, and give them training to make sure that they drink enough water, and take frequent breaks, find shade or a cool area, and dress appropriately. That is very much important for people who are at work and also at home, to make sure they wear a very light colored, loose, and breathable fabric, and make sure the protective equipments, the personal protective equipments that they use during work are not very tight, and the heat loss from the body is possible, and the safety is also ensured. Next. This is different levels of protection that should be in place to actually to protect the employees. The personal protection with enough hydration and actually PPE should be light, and the buddies should check each other to make sure that they are doing fine. And the administrative control the shift has to be managed, rescheduled in such a way that the person are not exposed in the sunlight for a long duration. There should be some hydration breaks, and heat alerts and advisories has to be given to them, and safety training needs to be given for, so that they can identify what are all the warning signs and report to the supervisor. And the engineering control involves having industrial fans, cooling system, temperature monitors, and reflective roofing, so that the environment is also cooler to minimize the impact of heat on the human body. Next. So the take-home message is heat is stress to the body, and the core temperature should be maintained by homeostatic mechanism to around 37 degrees centigrade. Heat-related illnesses are common in vulnerable population, and we have to take additional precautions to during summer to help in reducing the heat-related illnesses. And definitely, heat-related illnesses are preventable. Next. Thank you.
Thank you, doctor. Thank you for your insights on heat related illnesses. You started by explaining thermoregulation, and then you went on to explain the risk factors, symptoms, difference between heat exhaustion and heat stroke. It was very comprehensive. Thank you. We will now move to our next speaker, Dr. Karthik. I would request the viewers to keep your questions coming in, and we'll take them at after Dr. Karthik's talk. So let me introduce Dr. Karthik. Dr. Karthik Gunasekaran is a professor in the Department of General Medicine at Christian Medical College, Vellore. His areas of expertise include internal medicine, tropical medicine, infectious diseases, epidemiology, toxicology, and public health. He has contributed extensively to research and publications related to infectious diseases, heat-related illnesses, and public health challenges. He will be speaking about the broader public health implications of rising temperatures, medical complications associated with prolonged heat exposure, and the importance of awareness, preparedness, and timely intervention in preventing heat-related emergencies. Over to you, Doctor.
Thank you, Ms. Geeta, and I would like to thank Hindu for taking up this very important topic at this appropriate time. Can you?
Yes. Can we get Dr. Karthik's presentation? Yes, here you go.
Sure. Thank you. I'll just take you through what is how heat affects the health, and how it causes a global burden, and what are the preventive measures, and how prevention can actually decrease the morbidity and the mortality associated with this climatic disease. Next, first slide, please. So when you look at the rising global burden, the frequency and intensity of heat waves are increasing globally. And heat stress is a major weather-related cause of mortality. It causes an increase in hospitalization, emergency visits, cardiovascular complications, kidney injury, and also increase the mortality. So when you look at this graph, so the temperature is actually increasing. Every year, there are different models which have shown that temperature actually increases every year. So we have reached a point where the temperature is not going to come down, but rather it's going to keep increasing year by year. That is what we have seen in the current scenario, and also the projected models are consistent, and it is showing a rise in temperature in the future. Next slide, please. So these are some of the global heat waves and the mortality. So you can see the major mega heat wave that killed more than 70,000 people in the Europe, and also there have been in the Pacific Northwest, there have been a number of heat-related deaths, and also in our country, the 2010, the Ahmedabad heat wave, which actually resulted in more than 800 deaths per week, and the casualties there were more than 1,000. Next slide, please. So this graph actually shows the Indian scenario. So the ERA5 have looked at data from 1960 to 1989, and also compared it with 1990 and 2019. So what you can see in this graph is the number of heat waves that occur during these two different periods have actually increased. So all the red ones are actually the increase in number of heat waves. So as the year goes on, due to the climate change and global warming, the number of heat waves are actually increasing, which is alarming. Next slide, please. So this is again the Indian data. So they have looked at data from 2001 to 2020, and every year the temperature were actually increasing, and every year was worse than the previous year. And the last data that we have is 2020, which was the highest in the 20 years. So as per this data, in 2070, our temperatures are going to be even worse. And research has found that a mean annual temperature of 29 degrees Celsius is going to be difficult for people to handle. And currently, about 0.8% of the world lives in this temperature. Unfortunately, by 2070, more than one third could actually be having a mean annual temperature of more than 29, and living in this scenario is going to be catastrophic. Next slide, please. So based on this data, what we can infer is 73% of the Indian population will be in this um, temperature, and of that extremely vulnerable population, that is close to 700 million people, will be living in this temperature, and affected population can be as high as 1.2 million, which is kind of catastrophic. Next slide, please. So as ma'am has clearly mentioned, what are the who are the at-risk individuals? So as it affects from fetus to the elderly at every stage in life, it has its effects. So at the fetus level, what are the effects? It can actually affect the cellular division. It can affect an organogenesis, that is, different organs will be formed in the fetus, and can have its effects. In childhood, again, temperature can affect the thermoregulation, and because of children have a large surface area to mass, they are at risk of being affected by heat-related illness. Again, in adolescence, when we are exposed to the outdoor heat, and we are at risk of developing heat-related illness. Again, in adulthood, again occupational stress will be there, and people working in outdoors are at risk of developing heat-related illness. Pregnancy is another vulnerable population where fetal metabolism generates additional heat and increase in cardiac output and worsen the heat-related illness. Again, in midlife, because of the defective sweat glands and aging, you're at risk of developing heat-related illness. And later in life, once you become an elderly, that is more than 65, your chance of being affected by heat-related illness goes up because you have chronic diseases and limited mobility. If you're disabled, you have a high risk of being affected by heat-related illness. And if you have a cognitive impairment, again, it adds on to the risk of heat-related illness. So from this slide, what we can infer is from the fetus to elderly, heat has its effects on throughout your lifetime. Next slide, please. So this is a pictorial representation of how heat can affect the body. So ma'am has already mentioned about the input and output. That is, the heat generated from the body has to be dissipated. That is the output. Once there is a balance, then you are not exposed to not affected by the heat. But once this balance gets affected, where the input, that is the heat generated either from the internal mechanism or through external source, is not being able to be dissipated as an output, then you have the heat-related illness complications. So extreme heat and the intensity, the frequency and duration has its effects. And what are the pathophysiology that actually has its effects are? It causes an oxidative stress. That is, a lot of free radicals are produced because of the heat generated. There is an inflammation and electrolyte disorders, that is electrolyte imbalance can happen, and there is dehydration. So it is a multi-system disorder when you look at it. So any organ in the body can get affected. It could be the cardiovascular system, where they can have varying heart rate causing arrhythmia. They can have failure where the heart function is being affected. It can also affect the digestive system, where they can present with gastrointestinal symptoms like nausea, vomiting. It can also affect the immune system, where there can be an immune imbalance, and you're at higher risk of developing new infections. It can also affect the reproductive system, where pregnancy complications can be occurring because of heat-related effects, infertility, and adverse birth outcomes like stillbirth and preterm deliveries can happen. And respiratory system, we know that heat and the rising pollution can exacerbate COPDs, acute respiratory distress. They can worsen the asthma condition. Renal system has one of the most important effects, like they can have acute renal failure, chronic kidney disease, and they are more prone for developing renal stones. It can also worsen the endocrine system, like people with diabetes are at risk of developing complications because they can have these complications like diabetic ketoacidosis, and all this can be exaggerated by heat. And neurological system, they can present with delirium, ataxia, coma, and mental disorders can worsen during the heat waves. So these are some of the multi-organ involvement of heat, how heat can affect the system, the individual. Next slide, please. So these are some of the symptoms with which they can present. As I mentioned, they can have dizziness, they can have headache, they can have loss of coordination, they can have anxiety, and they can also go into a state of comatose. That is when we call them as heat stroke. It can also have an effect on the liver, where they can have liver injury. Kidney, as I mentioned, can affect the kidneys, and they can present with decrease in urine output. And skin, they can have heat rash and profuse sweating, or sweating can be absent in patients who are taking anticholinergic drugs. They can have intense thirst and dry mouth. Heart, they can have rapid breathing and irregular heart rate. Lungs, as I mentioned, they can have increase in respiratory rate, and they can have worsening of underlying lung disease. In the legs and arms, they can have heat cramps, muscle spasms, and weakness. So generally, they can present with dehydration, electrolyte imbalance, fatigue, nausea, vomiting. They can also have a drop in blood pressure with high temperatures. In pregnant women, how can they present? They can present fetal nutritional deficits. They can have preterm deliveries, and they can also present with stillbirth. Next slide, please. So when you look at it, the heat hazard, we need to look at what are the vulnerable population. So age, that is extremes of age, are at risk. Sex, female have a higher risk of being affected by heat-related illness, physical health, and people with disability, mental health. And what are the exposures? So outdoor activity, people who are at like manual laborers and people who lay the roads, they are the ones who are high risk. Work equipment, when you're dealing with the equipment which generates a lot of heat, then you are at high risk of developing heat-related illness. Environmental conditions, when your environment is very, the temperatures are very high, we don't have a shady region, not much of ventilation, and not much of air circulation, then you are at high risk of developing a heat-related illness. So when you look at it, you can have general impacts. So general impacts are nothing but the spectrum of heat-related illness, which can be as simple as a sunburn, heat rash, or heat cramps, to heat exhaustion, or a dreaded complication resulting in heat stroke, which is where patient can have confusion, slurred speech, and they can also have multi-system involvement. That is, it can affect any organ in the body, leading to a multi-system organ dysfunction, which will require a intensive care therapy. So what are the occupational health related impacts? So you need to have reduced cognition function, and risk of accidents can occur in factories because of occupational injuries. You need to give them more breaks, and impaired judgment because of the heat. And there can also be reduced coordination, and mental health problems can also aggravate when you're exposed to high temperatures. Next slide, please. So how do you manage these patients? The Ministry of Health and NCDC has actually laid down the guidelines how we need to manage a patient with heat-related illness and its complications. There are also guidelines being set up how these have to be managed at the primary care level, at the secondary care level, and at the tertiary care level. And also there have been guidelines how the ASHA worker and how they do a community level screening for heat-related illness, and how these people are being trained. There are modules available in the website which can be useful in capacity building. Next slide, please. So, what are the initial emergency management of heat stroke? So, what are the immediate priorities? First thing to do is move the patient to a shaded, cool environment, and we also would like to assess the airway breathing, circulation, and what are the mental status. If they are the mental status is good, that is, if they're conscious and they are responding to your call, we would probably give them some fluid, which will cold fluid, which will decrease the temperature. We need to remove excess clothing. So we need to expose them, move them to a shady area, remove the excess clothing, which will prevent the dissipation of the heat. And you need to call the emergency service. So the first key principle is cool first and transport second. First thing to do is you need to cool them first, and then because time is very as an important year, critical year, because studies have shown that early cooling actually impacts the morbidity as well as mortality. Then what all things we need to monitor? We need to monitor the core body temperature, as ma'am said. There are different sites at which we measure the temperature, like the axilla, the oral cavity, the sublingual. But core body temperature is something which is different from what we generally check for temperature. So this is different where the more blood vessels are there. So we either check in the esophagus if the patient is intubated, or the simplest thing is to do a rectal temperature, because your body temperature measured in axilla may not be that high, but your core temperature, for instance, patient presenting can have a axillary temperature of 101, but the core temperature can be as high as 104 or 106. So there is a difference between the regular body temperature and the core body temperature. So we would also like to check the heart rate, the blood pressure, the oxygenation saturation, and we would like to continuously monitor the neurological assessment. So treatment goals for a patient with heat stroke will be rapidly cooling the temperature. The golden time is less than 30 minutes. You bring down the core temperature to less than 39 degrees centigrade and prevent organ dysfunction. Because once they go into multi-organ dysfunction, then the risk of morbidity as well as mortality is very high. So a team approach is very essential, and we need to triage the patient and transfer them to an appropriate facility after the initial cooling. So wherever we are going to transfer also should be capable of managing such a patient. Next slide, please. So as Ma'am has already mentioned, there are three ways in which the body can dissipate heat, that is the convection, convection, and the radiation. So what is the gold standard is cold water immersion. So what do? They immerse a patient with heat related illness or very high temperature. What they need to do is they need to immerse this patient in a bathtub with cold water. So this can be done in a patient who is conscious. Like this can be when you look at heat related illness, there can be a heat due to exertion and non-exertional heat related illness. Exertion is when the patient is exerting, like an athlete or a manual laborer. Due to exertion, they develop the heat related illness where they are conscious. In such patients, we can probably put them in a water tub filled with ice, and this is one of the most effective way of for treating exertional heat stroke. And what temperature you need to maintain is about 5 to 15 degrees, and cooling rate should be more than 0.15 degree centigrade per minute. And we need to continue till the core temperature drops to less than 39 degrees centigrade. So what are the other alternative cooling methods? We have the body bag cooling, tarpaulin assisted cooling. These are all outdoor measures which can be used. And ice towel rotation, that is you place the ice towel, that is at the areas where there is maximum blood flow, like the axilla, the groins, and at the neck. These are the areas where the blood flow is maximum. So you are trying to place ice so that the body temperature can be brought down with the help of convection. So what we often practice is we at an institution we would probably use what is called the evaporator plus convective cooling. So as soon as the patient comes to the emergency department, we need to remove the clothing and give them loose clothing and spray water and put a direct fan, or put a wet sheet around them and use the fan so that the body's heat can be dissipated by evaporative and convective cooling. And this is one of the methods which are shown benefit and which are shown mortality as well as morbidity benefit in mortality as well as morbidity benefit. So what are the important points we need to look at? So cool the entire body surface and do not delay cooling for transport. So at that particular point itself, we need to shift the patient to a shaded region and start the cooling measures if possible. Continue cooling during transfer also if required. So rapid effective cooling within 30 minutes actually reduces the mortality and prevents organ damage. And we need to act fast and cool well can save lives. Next slide, please. So we have different ways in which we need to decide which are the patients who can be managed at the ward itself and which are the patients who need supportive and ICU management. There are different parameters we looked into. That is the way in which the patient breathing efforts are. That is what we commonly call as the respiratory rate or the patient's breathing rate, the heart rate, the temperature, the blood pressure, and the conscious state and age. So these are some of the factors that we looked into. There is something called the Gerato score, that is Japanese early risk assessment tool for predicting clinical outcomes. Have been shown as a good predictive score for deciding which are the patients who will require ICU care and what are the mortality will be. So based on this, we would probably shift the patient to ICU or probably manage them in the ward. So what are the supportive care? We need to give them IV fluids. So what kind of IV fluids we give is, we usually store the IV fluids in the freezer or in the fridge, and we give them cold saline infusion, which can actually decrease the temperature and also give them oxygen therapy if required. In ICU, we monitor them continuously with temperature monitoring. We put in a esophageal probe and monitor the temperature. And cardiac monitoring is essential because these patients can have low blood pressure. So heat stroke becomes a vasodilated state. That means your blood pressure loses its vascular tone and becomes dilated. So there will be a drop in blood pressure. And neurological assessment is important because heat stroke by default, by definition, is when the conscious state is also compromised. We also would like to look for complications affecting the other organs. So as I mentioned, it can have effects on the kidney when patients can have acute kidney damage. They can have muscle damage leading to what we call as rhabdomyolysis. They can have acute liver injury. That is, the liver also gets affected. There is a liver dysfunction where the liver enzymes can be elevated. It can affect the cardiac, that is the heart. They can have altering in the rate at which the heart beats, what we commonly call as arrhythmias. And it can also affect the blood parameters where your platelets can be low and the blood coagulation parameters can be deranged, what we medically call as DIC. And patient can also have CNS effects. They can have seizures or fits can happen. So what are the additional measures we do is, we give them, if they have shivering due to, we give them benzodiazepines, and if they have respiratory distress, we give them mechanical ventilation. So early recognition, rapid cooling, and supportive care will result in better outcomes. Next slide, please. So what are the preventive and public health management we need to look for is, heat stroke, as we all have discussed, is preventable, and the community has to be prepared. We need to have safer workplaces and ready events, and strong health system can actually save life. At the community level, what are the preventive measures we can do are health awareness campaigning. So spread awareness about heat, risk, and protective actions. And hydration advice has to be given. That is, we need to ask them to drink plenty of water, and we need to avoid alcohol and caffeine during the heat waves. Early warning system is something which can be established. Follow heat alerts and weather advisories. The IMD website actually gives daily updates about the temperature and the rainfall. So following the IMD website might be useful in planning your trips or outdoor activities. And one need to avoid outdoor activity, especially during the peak hours. That is between 11 a.m. to 4 p.m. or 3 p.m. Especially people at this, that is elderly, pregnant women, and children should avoid outdoor activity during this particular time. And what are the occupational measures? So we need to have work rest cycles, schedule regular breaks, give them cool shaded areas, dedicated cool and shaded areas for the employees to take rest, and give them a hydration plan, ensure water is available, and cooling stations provide fans, ventilation, And PP modification, already ma'am had mentioned that PP modification should be done, especially if you're working in a tropical region where the temperatures are going to be very high. And how mass gathering preparedness can be done, especially when you're looking at when you're preparing for a mass gathering, you need to have heat decks, cooling areas, and cold water immersion setup. And trained emergency team also should be ready at a mass gathering, so that at any point in time, if there is a person with a heat-related illness, they can be managed. And rapid on-site cooling capability also should be there, which will actually decrease the morbidity as well as the mortality. So healthcare preparedness, when you look at it, there is something called the Heat Action Plan. So based on the Ahmedabad 2010, the Ahmedabad Health Action Plan was set up. It is one of the first Asia's action plan to be set up, and that would actually prevent it's actually a multi-system. That is, it involves public health, the IMT, and the state level coordination, which would actually prevent the morbidity and mortality associated with this climatic disease. And dedicated cooling equipments, as I mentioned, the hospital also should be equipped with dedicated cooling equipments and measures. If a patient is been suspected with a heat-related illness, you need to have air-conditioned room. Studies from our own center have shown that in way back in 1990, our mortality rate due to heat-related illness was close to 90%. We did a study in 2004 where we found that the mortality had come down to 50%. That is probably due to the awareness. And in 2019, we had actually air conditioned our emergency department, and what we found was our mortality rate due to heat related illness was only 11.2%. So the hospital also, the healthcare facility also should be equipped to deal with such a condition. So that is also very important, and staff also has to be trained. So there are training modules available which they have to be updated at regular intervals. And institution also should set up heat stroke management protocols, and protocols are available in the NCDC website, so that can be taken, or the institution can have its own protocol for managing such um, a complicated situation. So awareness saves life, and hydrate regularly. That is, even if they are not feeling thirsty, we need to ask them to take frequent sips of fluid, which will keep them hydrated. And planning should be done well ahead, and workers should be protected. And when you're planning a mass gathering, you should be prepared for a event of heat-related illness. Next slide, please. So coming to what are the broader public health implications. So heat has its own effect on the body, as well as it can also have an effect on other socioeconomic and mental health as well. So heat-related illness, as we had mentioned, can present with the spectrum ranging from heat exhaustion to heat stroke, and we have already looked into the vulnerable groups. So studies have shown from India have shown that heat-related illness has its effect on mortality, and studies have shown that low-intensity, short-duration heat waves has direct burden on heat-related mortality, whereas longer duration, high-intensity heat waves have increased the mortality per week by up to 15%. That means heat also has its effects on other chronic conditions, which can have an indirect effect and increase the mortality. So you have two types of mortality in heat-related illness. You have a direct mortality, which is due to the heat-related illness per se, and you have an indirect effect. That is, patients with chronic condition become sicker during rise in temperature, which can lead to increased mortality. And studies from India have shown that it can go up to about 15% during the hotter months. So worsening of chronic conditions, especially cardiovascular and renal condition, can worsen. So patients with chronic kidney disease can worsen during high temperatures. And studies have also shown that increase in temperature actually changes the infectious disease dynamics. So vector breeding can alter, and the disease dynamics can change. We have so what are the diseases which can have its effects are dengue, malaria, chikungunya, Japanese encephalitis, and scrub typhus. So we have done studies from our center where we have looked at how climate can affect disease patterns. So we have looked at this particular disease called scrub typhus, and we have seen that climatic changes have actually had an impact in patients acquiring scrub typhus infection. And we are also undertaking a ICMR funded study called the Climb India study, which is a multicentric study looking at how climate has its effects on brain infections. So this is a pan-India study looking at centers across varied regions from climatic zones in India, and how we are looking at how climate has its effects on patients developing brain infections. And air quality and respiratory impact, when you look at it, most of the COPDs patients and respiratory disease can come with exacerbation during the heat waves. So heat wave also has effect on socio and economic impact. So there can be reduced productivity, there can be increased occupational related health risk, and food insecurity and malnutrition can be seen in high temperatures. And this can, if the temperature goes on, this can have greater economic burden from healthcare cost and loss of productivity and disaster response. So people with mental illness can also have their impacts, and high temperatures have shown as affected people with mental health, and even normal people can have anxiety and heat related stress. So it also has a significant strain on health system, because there is a high load of patients during this particular time, where there is two types of patients load. That is, one directly due to the heat related illness, and second due to the chronic disease patients who worsen during the heat waves, who will need medical attention. So there is an increase in demand in emergency as well as in critical care. We all know that resources are limited, so the number of ICU beds are less, and the patient becomes very sick. There is obviously going to be a increased load in this particular area, and there is also a risk for inequity and vulnerability. So, who are the people who are mostly affected? Are people with low socioeconomic status, with urban poor and marginalized, because they may not have good housing facility and good air conditioning. So these people are at high risk of being affected by this particular illness. So what is the way forward? We need to strengthen the public health action. So we need to invest in surveillance. More research needs to be done in this particular region, and early warning systems has to be set up. So we need to have an early warning system. Once the temperature goes up, that has to be conveyed to at least the at-risk people, so that they can take the preventive measures. And heat action plans has to be set up in every state, and it has to come from as a national policy. And we need to protect the vulnerable people, and we need to encourage them to stay in cooler areas and avoid traveling during the peak timing of heat wave, and build climate resilient communities. So green spaces has to be there, and we have heard of this term called as the heat island. So we all know that cities are turning out to be concrete jungles where there is less of green cover. And studies have shown that when your green cover actually increases, the temperature actually decreases. So when we are planning the cities and infrastructure, we need to make sure we have enough space for parks and gardens, and we need to encourage people to grow more trees, which can actually decrease the temperature. And we also need to strengthen the healthcare system by capacity building and supplies, and train people to deal with this um, heat related condition. So we need to act now, because from most of the models and studies, they have shown that the temperature is not going to decrease. As year goes by, the temperature is going to actually increase, and And studies have shown, models have shown that by 2070, the temperature is going to be really high. So to prevent that, we need to act now. We need to be responsible citizens so that in future can be safe. Thank you.
Thank you, Doctor, for the very informative presentation. I have to, just to sum up Dr. Karthik's presentation, I think he started with showing us graphs and numbers that really drove home the point of how heat is indeed increasing every year. And he went on to also explain the heat effects on each stage of our lifetime, and also on the entire human body, different parts of the human body. He spoke about emergency management of heat stroke and also rapid cooling methods. And finally, he also spoke about the public health implications of heat and heat related illnesses. We have a lot of questions from audience. We'll try to take as many as possible without overshooting our time too much. Um, most of the questions will have overlaps with both of your presentations, but we'll still take them because it's important to highlight these points. So we have one question from Mr. Akashit Thakur, who's asked, what are the most effective hydration strategies during extreme heat? Does drinking plain water suffice, or are electrolytes necessary? Do you want to take this, Dr. Jayachitra?
Usually, to get good hydration, water is enough. But whenever there is increased sweating, we lose a lot of salt along with water. So, in those conditions, it's better to replace the salt also along with water to avoid the side effects of dehydration. And in between, we can have buttermilk with salt, or sport drinks, or tender coconut water, or WHO ORS solutions. These things will help, but mainly the plain water will also be needed for hydrating the body.
Right. Thank you, Doctor. The next question is from Mr. Shiva S, who's asked how to deal with heat stroke or heat exhaustion when the outside wet bulb temperature is high or humidity is too high, that the body cannot deal with it by evaporating. Dr. Karthik, do you want to take this and also quickly explain wet bulb temperature, because that's something we have not touched upon so far?
Yeah, so when you look at the temperature, so you have the temperature and the bed bulb temperature. So what are the two things which plays are the temperature and the humidity. So humidity also, relative humidity also plays a role. So what we see in most of the smartphones will be there'll be a temperature saying 39, but you would also see what it feels like 48. So that is something very similar. So what your temperature, say if your temperature is say like 37 with the humidity of 30, relative humidity of 30. So your temperature can be between like 37.5 to 38. But once the humidity goes up, say it becomes say 90, the actual temperature might actually go up to say 42. So that is what makes a difference. So once the humidity goes up, your temperature also kind of goes up. So that actually kind of augments, and the body is not able to cope up that. So that is what is the wet bulb temperature. So what it feels like. So the temperature might be 39, but it might actually feel like 44. That is because of the relative humidity. Because humidity actually, you actually sweat a lot, and what happens is there is heat and there is sweat, and there is no if there is no breeze, or when there is no evaporation that is happening, then the heat is not lost, the heat stays within. So that is when people can go into heat-related illness. There are at-risk people, like people who are taking some anticholinergics, we call. So those are people who will have decreased action of the sweat glands. So sweat may not be produced, or when the sweat is produced and it is not being evaporated. Only evaporation actually gives the cooling effect. When that doesn't happen, then your body is not dissipating the heat. Then you go into heat exhaustion, and if that continues, you go into heat related illness. So what is the best way to deal with such a situation is you need to help in evaporation, so fanning. So what we do is earlier is all of you must have seen in the barber shop they use the spray. So we actually get those sprays, and we spray it on patient with cold water, and we put a pedestal fan, so that that will actually dissipate the heat. That is one of the best methods to dissipate heat, and studies have shown that by doing a evaporative plus a convection method is one of the best method, and it has actually shown decrease in mortality associated with heat related illness.
Right. Thank you, Doctor. We have another question that's related to hydration, Dr. Jayachitra, but this is interesting because the viewer, Mr. Joseph Raja, has asked about taking electrolytes, ORS, or plain water, particularly for people who have hypertension, who are on hypertension medication. Would drinking an electrolyte drink affect the sodium levels and raise the BP? Is this question.
Uh, if there is increased sweating and if the cardiac condition is stable, actually electrolyte replacement can be done with ORS, but we have to be careful and judge the patient's condition individually to decide whether they require an ORS or a plain water. It can vary from person to person. It's very difficult to give a blanket answer for that question.
Right. So we have to decide that on a case by case
Case
basis.
by case basis.
Right. So the next question, Dr. Karthik, do you want to take this? This is from again Mr. Akashit Thakur. He's asked about suicide rates during peak summer months. Is there any link between mental health and heat directly affecting brain chemistry?
Heat can affect the mental health, and as I mentioned in the slides, it can actually causes anxiety, stress, and people with underlying mental disorders, they will be on these antipsychotics. So that again kind of causes another form of hypothermia. It's called. So that is different from heat-related disease, and whether heat related during the warmer seasons, does the suicide rates go up? We need to look at data for that. But what we have seen, we have not really seen an increase in the suicidal rates during the warmer months, but we need to look at actual data, the national wide data, to see to really comment on that. But it can affect the mental health definitely.
Right, doctor. The next question I want to pose is to Dr. Jayachitra. It's from Harini R, who's asked if can using sunscreen help in prevention of heat-related illnesses to some extent. How does these sun protection factors really help?
Actually, the sunscreen lotions and other things is for preventing sunburns. And actually, it prevents the infrared rays from the UV rays from the sun from affecting the skin. So, using those may not be sufficient to avoid heat exhaustion and heat stroke. It is mainly cooling the body, keeping ourselves hydrated, which is more important for preventing heat related illnesses. And the sunscreen lotion has to be applied not only in summer and all days. Even when it is a cloudy day, the UV rays can affect the skin. It doesn't matter whether the temperature is 25 or it is 35. It has to be applied every day to avoid the bad effect of UV radiation.
Right. Thank you for that point, doctor. The next question is for Dr. Karthik by Mr. Shivam Tiwari, who's asked, what are some precautions one should maintain for heat-related issues within the geriatric population?
Yeah, thank you for that question, because as I mentioned, geriatric population is one of the vulnerable. So extremes of age is vulnerable population for heat related. So we need to ask them to stay in a cool place, and we need to ask them to avoid traveling during between 10, 11 a.m. to 3 p.m. or 4 p.m. and adequately hydrate them. Even if they're not feeling thirsty, they should keep taking fluid, water or ORS to keep themselves hydrated. So that will actually prevent, and place them in a cooler place, like in an air conditioned place, or at least have a good ventilation, and with fan facility. So those will actually will decrease the occurrence of heat-related illness. And genetic population, they also will have multiple comorbidities. What I meant is they might be diabetics, hypertensive, and they must be on multiple medications as well. So those also will have its effects. Like if they are taking medicines like diuretics, so those are the patients we need to take good care, because that will cause fluid loss. And during the summer they'll have dehydration. So those are the patients we need to give attention and ask them to hydrate themselves at frequent intervals, and that will actually prevent them from going into heat exhaustion or a heat stroke.
Right. Thank you, Doctor. I myself had written a bunch of questions, on this topic. I'll try to sneak one in. Dr. Jayachitra, can you tell me, in places where we use air conditioners, almost, in offices, ACs run all day, right? So, is there any concern when there's a sudden temperature shift when you stay in AC for a while and then you step out to have lunch, or you experience that heat, and then again you come back to this very cold AC environment? What does this change sort of affect your body? Is there any effect?
It's better to avoid sudden change in temperature from a air-conditioned place to the outside hot weather, but sometimes it cannot be avoided. Right? So we have to be careful and make sure that we are well hydrated before we go out, and I don't think that can cause a major problem in the usual population.
Right. Um, thank you, Doctor. Dr. Karthik, I wanted to ask you. So, when we talk about heat-related illnesses, heat stroke is one, heat exhaustion, as you both mentioned. But do hospitals see other kind of, say, kidney problems or other issues? Is there a sort of an increase in patients coming with other issues that might not be directly linked to heat, but also is a factor for these illnesses?
Yeah. So as I mentioned, when you look at during the heat waves, there have been studies done from India where they have looked at the morbidity or the mortality directly related to heat. So when you define heat wave as less intense with a shorter duration, you have increase in mortality directly related to the heat exhaustion or heat stroke. When you look at definitions with the longer heat wave, and when the heat wave is lasting for 2 days or 5 days, and that has its effects on patients with comorbidities. What I meant comorbidities, when you have a underlying cardiac condition, like if your heart is not functioning properly and you've been on medicines to augment your cardiac function, and you have a diabetes, or when you have a renal dysfunction. So those are the patients who can be affected, and the mortality has increased by 15% per day. That is what studies have shown. So definitely we are seeing an increase in number of patients who present with cardiac problems during heat wave, because
Yeah, I
they need to be.
specifically asked because a lot of people are pushing states to give compensation when there's death due to heat stroke or heat. But what happens sometimes is the actual cause of death is not mentioned as heat related. It's usually cardiac arrest or kidney failure, something like that. But so then, how do we sort of bring the aspect of heat in so that people get their due? And we
Yeah. So
directly link it with heat.
when you look at the data for heat stroke, so every center needs to enter the heat-related death heat-related illness in terms of heat stroke has to be entered in IHIP, that is Integrated Health Information Platform. So every institution needs to enter data for heat stroke. So that data includes only heat stroke. So patients who come with comorbidities and who are not able to cope up or acclimatize to the rising temperature with an underlying comorbidities, like if they have a cardiac failure, and during heat obviously the symptoms worsen and they get admitted, requires treatment, and sometimes they may not even make it and they was mortality. So those mortality may not directly come under the heat related illness, but they will go under the, as you rightly mentioned, will go under the cardiac failure and mortality. So that is something which we need to look into. So that is what, as I mentioned, the way things are going every year, the temperatures are going to increase, and each year is going to be worse than the previous year. So right now we need to look at how to break that the same. I mean, how to bring back the temperatures to what it was 10 years ago. So we need to sit down and have some preventive, because even the healthcare facility, it's a big burden, because even the cardiac failure patients who come with stress, if they have been managed in a ward which does not have an air conditioned facility, it's going to be difficult for them, because the worsening is due to the heat, and if they're not been monitored and managed like a heat related illness, it's going to be difficult for them as well.
Right, right. Thank you, Doctor. Dr. Jayachitra, I would like you to take this question from Mr. Dinesh Verma, who's asked, what advice for heat strokes, especially for people who go into jobs between 8 a.m. and 2 p.m.? That's the working hours, and the job is not sedentary, so they have to maybe keep moving around. So, are there any tips specifically for this?
Usually the heat is more towards afternoon from 11 to 3 p.m. or something. So better if they are starting at 8 o'clock, they can actually finish most of the work on the earlier part of the shift, and keep them well hydrated and take frequent breaks in between and come to a shady place. And the clothing also should be light colored, loose fitting one with proper protective, personal protective equipments. And if they take care of all this, and if they have any signs of, say, warning signs of dehydration, like any cramps or something happening, and they feel slightly dizzy and they feel tired, then they have to inform their supervisor and make sure that they take the break and hydrate themselves, and depending on their condition, continue to work or take a break from work on that particular day.
Right, right, doctor. One more question that I had was, there's a lot of talk about fitness these days, right? A lot of people are hitting the gym, they're go running, practicing for marathons, etc. So, many of these people continue to work out, despite high temperatures outside. Even some exercise outdoors or run outdoors. A lot of children also, because it's summer holidays, they tend to play outside their flat, in the apartment play area, etc. So what precautions and we especially see videos of people just dropping in the gym and all that. So what precautions, specific measures should runners and gym goers and children who are outside playing cricket or whatever take during these hot days?
Uh, uh, so the workout can happen either indoor or outdoor. Okay, indoor, usually if it's an air conditioned one, there may not be much problem. But with workout, there is a lot of heat production inside the body, and the hydration is very important. And keep before the start of the exercise, they have to be well hydrated and keep themselves hydrated. The workout is going for a longer period of time. But if it is going to be an outdoor activity, better to avoid during extreme hot time of the day, around afternoon time when the sun is at its peak. Better to go in the early morning or in the evening after 4 or 5 p.m. If they can shift the workout timing in a cooler time, it will be better. And the same thing of making sure that clothing is not tight and not multiple layers of clothing should be avoided, so that that can interfere with the dissipation of heat. And hydration is very important, and it's very important for them to acclimatize with heat slowly. And if somebody is starting workout and suddenly going out in sun and working for a long duration may not be a good thing, and they should make sure they expose themselves to the hot climate slowly, maybe start with 15-20 minutes, and get the proper training to do it, instead of starting all at once and exposing themselves to the heat. And people with comorbidity should be very careful. Dr. Karthik told, there are a lot of exacerbation of comorbid conditions during hot weather, and it's very important they think about all that, take sufficient precautions to avoid going out in the extreme hot climate, and prevent complications of their chronic illnesses.
But doctor, just a small follow-up question. The humidity seems to be high even outside of this peak heat hours, right? Even in the evening when you walk on the road it's very sweaty. So already you're sweating, and in that time, if you're jogging or if you're doing some exercise, that's is that advisable, or any set of people
Usually,
should
even though the humidity is high, there will be cool breeze happening in the outdoor in the evenings. Chennai, for that matter, is little. We are lucky in getting cooler breeze from the sea, unlike other places in our state. So that will help. And if the humidity is more than 70, then there is problem of evaporation. The evaporation may not be in proper to dissipate the heat of the body. So if the humidity is less than 70, those mechanisms will also help. So as I told you, hydration is very much important, and the type of clothing and training, all these things will definitely help.
Thank you, doctor. I think it's a point because now people should also start checking the humidity level. Usually, we check only the temperature, 38, 40. So, I think humidity is also one thing that we should keep in check.
And
We do
exercise is
have,
also important. People
yeah,
should
that also.
stay indoor and not exercise during this period, because for all people we advise healthy diet and exercise as a constant thing to prevent health
Yeah,
problems.
yeah, right. That's right. We do have many more points to discuss and questions, but I think we're running short of we've overshot time actually. So I think we'll end with this one question: how can communities build heat resilience in a way? This is from Mr. Bikash Keshri, in a way that protects vulnerable groups such as children, older adults, outdoor workers, and people with chronic illnesses. We did discuss this during the presentations, but do you want to round it off, both of you, please?
Can you
Do you
take up
want me
that,
to repeat the? Can I repeat the question for you?
please?
How can communities build heat resilience in a way that protects vulnerable groups, such as children, older adults, workers, outdoor workers, and people with chronic illnesses?
The best thing is to create awareness. So people know that there is a thing called heat related illness, and how it can affect their health and how to protect themselves. And if we can create the awareness, an individual person will definitely take precautions to avoid problems. And also bringing up indoor activities, stadiums, and other things, so that if it is air conditioned, people can work out better. And that is the main way to make sure people exercise at the same time they don't get into heat related illnesses.
Dr. Karthik, do you want to give your thoughts?
Yeah, so promoting adaptive measures like I'm said to drink water, hydrate themselves, and cooling centers within the community, and use green uh, filters or paint the roof with white. So those are some of the measures which can actually decrease the temperature. And when you're planning a community, you need to have buildings with dedicated area for parks, and have a green zone. And studies have shown that having a green zone will actually decrease the temperature, and will there is something, the concept called as heat highlands, which can be seen in urban setups, especially when you have all these tall buildings without much of green cover. So increasing the green cover will definitely have its role in decreasing the temperature. So we need to encourage them to plant more trees, have a dedicated area for children to play in terms of park, and keeping the elderlies at home during the peak time, and hydrating them, and checking on them at regular intervals to assess the conscious state, and hydrating them will actually will decrease uh, uh, people from going into the complications of heat and the associated diseases.
Right. Thank you, doctor. I think both awareness and green spaces are something that we should look at in a systematic way to mitigate, the effects of heat and heat-related illnesses on the body. So I think with that, we will conclude the session. I would like to thank Dr. Jayachitra and Dr. Karthik for your excellent insights and advice and tips. Thank you both. It was great having both of you discuss this particular and very important topic, heat. And thank you to our viewers and participants as well. Do subscribe to The Hindu. We do a health webinar every month, so you don't miss out on such informative webinars. Thank you. Thank you all.
Thank
Thank you,
you.
Ms. Geeta. Thank you, Dr. Jayachitra, ma'am. Thank you.
Thank you. Thank you, Dr. Karthik.